All right. Hello and welcome to all of our school folks who have joined us today on this call. We are here in the boardroom with many different representatives from the State Department of Education and all of the different offices of support that they represent. We are recording this, so it will be available for those who are not able to be on the call, if that's of help for those who are participating. If you are on a computer, you are able then to contribute a question. What we will do is gather those. If some of them need to be synthesized together, we will try to hit on those questions. My plan is, again, I don't know if I said this is Joy Hofmeister in case I didn't, but the plan is to have some of the things that we anticipate you may have questions about, I'd like to try to cover in the first 20 minutes and then leave 40 minutes for Q&A if that's all right. All right. Okay, so we'll get started here. And again, welcome. I want to restate that nothing is more important than the safety and well-being of our kids. The State Department of Education is working closely with state and federal leaders, health experts, and the CDC, and a range of other entities to ensure that we are making decisions that are the right things for our Oklahoma students and Oklahomans in general. Yesterday evening, the Department of Education provided you with specific guidance. Much of it was designed to help your schools act swiftly and firmly in an event of a school closure, whether that be locally in a region or at a larger scale, or in isolated incidents. The key point is that we want to remove any impediments that otherwise would dissuade districts from closing if necessary. All right? So we are already aware that we need to add a number of resources to what we sent out last night. And really, things are changing by the hour. So please keep that in mind. What we sent you yesterday is a start, and it is being updated. So please, you can click on that, and we'll indicate with a change in font color, I believe is the way we've determined we'll do that, where you will be able to see any additions or changes that have been made to recommendations or guidance. And that is available when you log on to the State Department of Education website. It should be very apparent at the top. Let's see. Similarly, we also want parents and families to understand that they can make decisions that they feel are the best for their own kids. We are not having conversations right now encouraging students to be in school like we would ordinarily related to chronic absenteeism, the importance of attendance. While we know that is a discussion we have normally, this is not a time of, I'm sorry, is there a problem? Okay. This is a time for a different approach. Just want to mention to you that it is not a time of panic, and panic never helps any situation. It is a time for preparation, and we want to be able to give specificity, because I do believe specificity is key to making well-considered decisions and passing on some of the thought process that goes into those decisions at the state level to assist you as you are also having to make other decisions at the local level. So please ensure that the information you pass along is accurate, relevant, and specific to the Oklahoma situation, especially at a time where we're hearing announcements from other states. We'll get into a little bit of that in just a little bit. But it's very important that we are speaking about the Oklahoma condition right now. With next week being spring break, this is a good opportunity for our districts to prepare, and for the state agency and other agencies within the state. School boards should consider using this time to consider having a special meeting to address any policies that need to be put in place that would assist with a coronavirus response. And we tried to give some information on our FAQs called Coronavirus COVID-19 FAQs for Oklahoma Public Schools, and that is available on our website. But those would be policies that might need to be updated, including emergency preparedness plans, student attendance, employee leave policies, and travel for students and employees to school-sanctioned events. So some of the things to be considering as you think through a tiered approach to responses that would be required of the district. All right, but first things first, let's talk about school closure. The recommendation we have from the Centers for Disease Control is that large-scale school closures may not be particularly effective in containing or mitigating the spread of the virus. According to the CDC, and we just had a national call with them late yesterday afternoon. In fact, we'll be having another round of calls later this afternoon. I just got word, and some of the people at the table don't know that's about to happen. But the experience, according to the CDC, the experience of other countries has shown that large-scale closures to have negligible effect. So one of the things in fact, what they were sharing with us is that students are most safe in the clean and healthy environments of schools in some cases. So we want to talk a little more about this, and allow me to just keep moving through some of the remarks that we have prepared to discuss. What we know is that there is a specific case let me back up. What we know is that if there is a specific case in a school, then that may warrant a short-term closure for a few days to investigate and disinfect. Large-scale closures are not advisable until and unless there is community transmission. And at that time, schools should be prepared to be closed long-term, perhaps until the end of the year, the end of the school year. All right, so let me break that down for a moment. Large community transmission, Carolyn, is that in here? Okay, let me keep reading then. I want to emphasize that I just said schools must be thinking about and prepared for the possibility of a closure until the end of the year. So while we're thinking about that, however, schools should think about restricting interactions of large groups of students as well. So for example, modifying how many students are in halls at a time or in a cafeteria or gym or playground are part of recommendations that the CDC is providing for us. Schools also need to keep in mind that the community will be impacted if the school shuts down, particularly if they shut down prematurely. Child care centers follow the lead of schools in that closure. And with no child care available, many families will be forced to stay home. And this will impact our healthcare providers at all levels if facilities for child care are closed prematurely in a following of a school's lead. So what we're asking is that as we think about this, we are working together to think about the larger community impact, which would be the purpose for any consideration for closure of school on a isolated or regional or large scale anyway. We are monitoring the ever-evolving situation with health and emergency management experts. It is important not to close schools too early or too late, but instead to act when there is evidence of a community transmission. All right, let me break down what a community transmission is. Community transmission are cases of unknown origin, meaning it is not directly connected to another case or travel. So if two instances of community transmission surface in a population of 800,000, it is a good indicator that 1% of that community is carrying coronavirus. So for where we are today in Oklahoma, we can trace the origin to the coronavirus confirmations to travel or directly to, I think actually travel is what those are. However, if you, like I did, and I know many of you are looking at different states and, for example, Maryland, Ohio, and their governors made presentations about the requirement for closure or regional closures, I think, are even being considered in some other states at this moment. But they use the term that they have community transmission, and that is following the CDC guidance. And that's the guidance that we want to follow. I hope that's helpful. We'll talk about expanded testing, and that's not our state assessments, but that is testing for COVID-19. So just announced is new, more aggressive testing criteria. Hospitalization with COVID-19 symptoms, symptomatic individuals who are older, immunocompromised or with pre-existing conditions, and those who have had contact with confirmed patients or those who have traveled to affected geographic areas. This one, I believe, emphasizes healthcare workers as well. Let's also discuss travel and quarantine rules. We should point out that most of Europe has been elevated by CDC to a level 5. I'm sorry, no, I am not breaking news right now. That it has been elevated to level 3 status, meaning that anyone who travels to those countries, a level 2 or 3 country, must self-contain for 14 days. If we've had this question as well, if it is a level 2 country, but it is not based on the CDC's level 2, based on the coronavirus, that is, but it's level 3 for crime or something along those lines. I think there's some questions about Mexico right now. We need to stay vigilant to look at the most up-to-date information on the CDC website as it pertains to this self-quarantine. There has been a lot of discussion about the possibility of distance learning. I want to touch on that, or virtual instruction during this time of planning. We are not recommending that all districts across the state shift to a virtual model in order to make up days or continue learning through a virtual process because of factors that are related to equity. However, there are schools that have been long planning these kinds of opportunities for a distance learning model, and that certainly is something that has already considered equity issues where students don't have access to the internet, or they haven't thought through who is the teacher and how is that teacher trained to deliver those kinds of opportunities. So if they've already factored in the answers to these questions of equity, that's different. But for the most part, a response and change to address today's issue alone is not advisable. We do have Aaron Esfalt on staff, and he is a resource to have discussions if you have questions about whether or not you're ready to go with such a process, or if that's something that you want to talk through that equity piece or preparedness and readiness. Let's see. Okay, we're going to discuss assessment. That would be our state assessments and accountability. And I want you to know that there is broad flexibility in these circumstances with our state assessments. And it's related also to issues that we can talk about with a waiver. And we will be exploring and preparing for any scenario that our state would encounter, and we are in the process of doing that in child nutrition, which we'll speak of in just a moment, but that applies to any of our accountability or assessments as well. That does not mean that we have today made any announcement about changing our testing schedule or changing plans for the state. But we are making plans today to be ready for whatever comes and whatever is needed. Let me just toss to Brad Clark, who's able to maybe share a little bit about significant medical emergency waivers.
Sure. Thank you, Superintendent Hofmeister. All of what I'm about to get into and discuss is set forth in the guidance document that we were referencing earlier, but I'm going to go into it again and really talk about it in two respects. One, in terms of assessments, and then secondarily in terms of chronic absenteeism related to school accountability. In assessments, and this is something that has been in practice for several years, districts may request exemptions for students who have experienced a significant medical emergency. We would strongly encourage districts to prepare for those submissions at this time, and those are submitted through the state testing app. Again, this has been in administrative code for several years relating to state testing. We did want to bring that to your attention at this time, though. So shifting to chronic absenteeism, there's also a process in place where districts can request and make determinations about exemptions to classify a student as not being chronically absent if that student has a significant medical exemption. In years past, districts requested those exemptions through the State Department of Education. That has changed. At this time, districts are to make those determinations locally. We would encourage you to begin making those determinations and prepare to make those determinations from the chronic absenteeism indicator. At the same time, I want to emphasize that we are prepared to make a uniform determination for all students in the state if that becomes necessary and advisable.
And another provision that we're doing, you probably, if you've had a chance to digest the 10-page guidance that we gave yesterday evening, you would have read that we are going to also exercise a piece in the law that allows for us to define the dates related to a measurement that we will apply to chronic absenteeism. Which would be that if we do, as for today, what we're planning to do is take to the state board in our March board meeting, and we've already had conversations with our board members about this as well, so this is not new to them, but a request to change the scope of the date range where we would be measuring chronic absenteeism, which would be the beginning of school until March 1, and not include anything past March 1 in that indicator. And that is our recommendation at this time. Earlier this week, we applied to the U.S. Department of Agriculture for 4 waivers to ensure that students will still receive nutritious meals in the event of a lengthy school closure. These waivers would provide greater flexibility for districts to have grab and go or delivery of meals. And we are also making similar moves to ensure more flexibility in matters such as state testing, as I just mentioned, accountability, and with special education. Jennifer, do we have any updates yet on that?
No, I know that the congregate feeding and the unanticipated school closure waivers have gone to national office. Okay. I have not heard word on the other 2 we applied for.
All right,
so no approval.
We've moved from the regional approval in Dallas, and now it's moved to DC.
Correct.
Okay, so that's progress. Those are anticipated, even a 72-hour turnaround.
I haven't been told that, but
okay,
if you
have
heard that, maybe
somewhere.
that's the case.
That's what we heard. So we are anticipating an answer on these things soon.
Yes.
Okay, and then it goes without saying that we need to underscore that families and students, regardless of whether they are on vacation or back from vacation, that they exercise caution and common sense. And that does include teaching our children, as I know you've already begun this, with washing hands often and what that means and how to properly do that. It is the most effective line of defense, as the research shows, and practical social distancing and wiping down surfaces. Just heard today that and many of you who follow the national reporting on this have probably already heard this as well, what we thought was going to be a 12-hour life of coronavirus on surfaces is now estimated that instead on stainless steel and plastic surfaces, it can live up to 72 hours. So keep that in mind. This is part of why the thought around having a closure for sanitation protocol is very needed under certain conditions. And one thing that we want to already tell you that's coming is a second set of guidance that will share with you the protocol that is part of a conversation that was shared with state education chiefs yesterday with the CDC. And some of this is related to a school's decision tiered protocol of what is advised in a practical way with different levels of progression of the coronavirus, and how what that looks like through a decision protocol. There's various phases from a preparedness phase to mitigation and containment, and then there's the substantial community transmission. And each of the phases have different recommendations and actions for schools, their staff, children, and families. More than anything, we want to support families who have concern and fear, and that would be related to how this would impact their own child, perhaps, that has a suppressed immune system, or a family member with a suppressed immune system, or those who have higher vulnerability. And we do not want to put pressure on any family that it's fine, we need you in school, anything of the sort. That goes as well for those who are staff members, or those that feel it is unsafe for them to be at school. Or the other word we would like to convey is just that if teachers will take it upon themselves, if they are sick, to stay home. Of course, that is something that we know makes sense anyway, whether it's strep or flu. It will certainly assist in making sure that we're not transmitting that further, and that we keep everyone's health and well-being strong. Child nutrition is a key piece to the equation. We really do not want to close schools earlier than when appropriate. If we do not have waivers in place, there is a lag time where we can ensure that kids stay strong and healthy with nutritional meals. And then finally, I think it is worth noting the individuals talking to us yesterday on the line from CDC explained that they are studying and have done mathematical models of the countries with coronavirus, and comparing those that closed schools and the timing of that compared to other countries and outbreaks. And these recommendations at this time, with these various levels of protocol assigned to the different phases within a community, are important to follow because they are based in science and evidence based on this research about this problem today worldwide. So I hope that that helps a little bit. And at this time, we will go ahead and open it up for answering some direct questions.
Okay, and this is Carolyn, and Superintendent, we have a few questions that have come in, but as you have other questions or would like things repeated, please go ahead and enter those into the chat box, and we'll do our best to get to as many of those as we can. First question is, Superintendent, could you please repeat the size of the population for community transmission? How do we know when community transmission is occurring?
What's being discussed is a population size of 800,000, around the size of Tulsa, and 2 cases of unknown origin. And there is a presumption that there would be a 1% coronavirus positive coronavirus within that population. So these are figures that are being shared by those national experts. Of course, I mean, anytime we describe that, that could be subject to change as evidence and research shares information differently, just as you've seen with how long something lives on a surface, a hard surface. And that was based on evidence in that change. All right?
Superintendent, do you have any recommendations for busing of students? Is it safe to bus students?
Well, clearly, it is a smaller group than 100, and it's also a time where, you know, having the wiping of surfaces is, I think, very important. So, I mean, these are the kinds of situations that, I mean, I think we have to get an answer not from me, but from the CDC and from those who are better suited to answer that. At this time, there is not a specific discussion about stopping busing. I think that's something all states are dealing with, and we would have a recommendation about that if that was a large threat.
Superintendent, we have a question about testing and the significant medical conditions.
Hey, I want to go back to this, though. But that is why it is important for the self-quarantine to occur for those who have been in countries that fall within the guidelines of having traveled to level 2 or 3, or those guidelines are also changing. In fact, I understand that there was guidance around domestic travel as well that came out today and yesterday. Okay, recently. So it's important to keep current with those advisements.
Okay, with regard to testing students that have significant medical conditions, so for example, if a student had asthma or has a suppressed immune system, would that student be eligible for the significant medical exemption?
I think it's important to say out front that each of these are going to be determined at this time on a case-by-case basis as they have been in the past. But what we are talking about is if the request for an exemption is related to the coronavirus. So if that asthma or reduced immune system is related to a request that's based on coronavirus, I think that the answer to that is probably yes. In the guidance document that was sent out yesterday, we did stress and again want to emphasize that when the department is reviewing these requests, that we're going to give broad parameters to districts on these testing participation issues.
Okay, we've got a couple of child nutrition questions, okay. Jennifer. First, could you share what districts need to do now to be able to, in preparation for applying for whatever flexibilities we might be able to gain once we get those okay from the U.S. Department of Ag?
Schools need to go ahead and apply for the seamless summer option. The application's open. It's in our CARS system, which is our application and claiming system. So we're recommending schools to go ahead and apply for the SSO, which is the abbreviation for it. If you have questions, our office can help you with that. 405-521-3327. And once you're approved for that, even if you don't have to use it, go ahead and apply. And again, waiting on waivers as far as the congregate feeding, because obviously if school's closed and we're supposed to be not being in mass groups together, you would want to maybe have a drive-through grab-and-go for meals, potentially, or the option is there in the waiver that we submitted to possibly deliver meals. And there's different options there as well as far as how you might deliver that. That would be left up to you. I cannot send a waiver in to waive regulatory paperwork. So once approved, we're sending an approval letter to the school and a packet with the paperwork that needs to be completed. And we will be once we know if these are approved, asking of the waivers which one you will want to implement. We have to track data for reporting purposes.
And just to follow up on that, Jennifer, we have a question about meal patterns and the things that are required to be in meals. Will there be flexibility if either certain products can't be used in a grab and go, or if certain foods become unavailable?
I have asked for a waiver for meal pattern flexibility and have not heard back as to whether it will be approved or not.
And just to add to that, we are communicating with our federal delegation, and the governor's communicating with the White House on our behalf to try to speed these waivers along. So we hope to have approval on that in the next few days. Okay, Superintendent or Brad, this is probably a question for you. So if we are forced to close for the rest of the year, will schools still get their state aid payments?
Yes.
Are there any other plans or things that you would like to elaborate on for state aid?
ADA, yeah. Do you want to talk about the ADA?
Yeah.
Yes.
So I think the answer is yes. Once again, we will continue with operations as normal at this time. There are not anticipated to be any disruptions in that. We do look at all avenues here, and so I'm going to talk about average daily attendance for a moment, or ADA. There are considerations just to look at them and see what can be done if determined necessary. The State Board and State Department have the authority to set the time frame that the ADA window looks at. And so just like we were talking about earlier about the chronic absenteeism potentially being for, instead of a full school year as we might normally think of it, potentially looking at the ADA window as beginning of school year through, let's say, March 1st. And so resetting that as we normally think of it, but that is being looked at. Okay,
Superintendent and/or Brad, we've had a couple of questions about virtual schools and transfers to and from virtual schools potentially during this time. Would you have any thoughts or comments on what on that potential issue?
Superintendent, do you want to
You
take
go
this?
ahead.
Okay.
Sure. I'm sorry, I'm reading as people are texting that are not getting into they don't have a computer in front of them, so sorry.
Can you read the question one more time, please?
Yeah, I think that there's concerns about students transferring to virtual schools when a school might be closed. And have we thought about that? Do we have any advice or guidance on that issue?
Actually, I want to, and we were discussing this earlier, make a request of the statewide virtual charter school board to pass some kind of measure resolution that they would not accept new students during times of the final piece of large-scale changes, or that we would also take action if we saw some kind of effort to do that at this time where districts are grappling with doing what is the right thing for student safety. I heard the New York Attorney General explain that related to price gouging on hand sanitizer as an example, and she said, there's not a certain price that it becomes price gouging, but you know it when you see it. So just know that we will be prepared to take action to prevent that.
Okay. Superintendent, we've got some questions to ask you to repeat some of the things with regard to travel. So what are recommendations for students and or faculty that travel to a level 2 country over spring break upon their return? And then also questions about students traveling to potentially affected areas within the U.S. over spring break. How is a school to receive those students when they return, or faculty?
So, yeah, I'm happy to jump in here. On page 1 of the guidance document, we get right into this discussion and do not differentiate between staff and students in this respect. If an individual travels to a level 2 or 3 country, China, South Korea, Italy, Iran, Japan, or another level 2 or 3 country, the guidance document is very clear that the individual must self-quarantine for a period of 14 days before returning to school.
And we've gotten several questions about the size of gatherings of students, whether that be in school or events and activities that are out of school, and additional questions about rural Oklahoma in relation to the 800,000 criteria. And I think just perhaps a blanket statement, again, as we've said before, this is all an evolving situation, and we're sharing the information that we have now, but these are all important questions that we will seek to provide answers to you either later today if they become available or in the very near future so that you have clarity about those things. Okay, we have questions about the requirements for the 180 days or the 1,080 hours. If there is a large-scale closure, are schools going to be held to those requirements? Or if schools take off particular days, are they going to be required to make up those days?
So if there were a large-scale closure, the state board has the authority to waive the requirements for the 180 days or 1,080 hours. That is in statute. It was utilized in a particular situation last year with the flooding that occurred. I think we're prepared to do that if that
Right.
becomes necessary.
Okay, we've just got a few questions left that have come in that we haven't answered yet. So if there are others out there, please go ahead and send those in now. First question, do you think that we're going to have another teleconference when we receive new information?
Well, this is scheduled every week, Friday at 1 o'clock. So please plan on that. And then if we have to have it sooner, we will. But we have our health department update at 10 o'clock, and we scheduled this as we met with our education coalition, our outside partners. We made that decision when we met with them, I believe it was on Monday morning. And we're meeting regularly as well with the education coalition. And then we are meeting regularly with those national partners, and then, in fact, that's more daily. We had this morning a really strong, robust meeting with a whole host of large agencies that are going to be impacted by any kind of response at a statewide level. And it was a meeting that truly I wish a lot of people could have witnessed. There's a lot of comprehensive planning going on. Schools are going to be a big part of that. One of the things that we want very much to do is to stay in very close contact with our school leaders. I believe that having these kinds of phone exchanges will be necessary on a regular basis, and then if we need to call them sooner. I think there's a question I have, and we may want to give you a little bit of time to respond to this, but do we need to meet before next Friday with the very nature of it being spring break and families and schools? Now they're all, everybody. Okay, so what are we saying?
Okay.
By the way, we are on the phone with OSSAA. In fact, I was on the phone with David Jackson just right before I walked in the room to start this call. And so that is something that we are trying to share information together so that they're able to make their decisions, not based in rumor. I would really caution people from making decisions based on things you haven't heard firsthand, and definitely rely on written communication from our agency. You're always welcome to borrow what we have and to use some of the information that we share with families. We would ask, this was one of the requests that came from this morning's meeting at the state level, was to request that schools recognize how important their words are, their trusted words in your community, and that all of the messaging needs to be sure that you have the most timely and accurate information to share, and that it's consistent with the CDC.
We have a question about testing. We've talked a little bit about state testing, but what about WIDA testing? Do we have any information on WIDA testing?
Yes, Craig.
Yeah, so we have been in discussion with WIDA regarding whether or not we could extend the window if needed. There's about 2 more weeks in the window, and we are going to play it by ear with WIDA. They tell us that they can help us mitigate that issue if needed. So like I said, there's only 2 weeks left in the window, so it should be a very few number of students, but I think we can address that if it comes to that.
Superintendent, we've had several questions. I think we answered the question about travel outside of the country, but I don't know that we've clarified any guidance on travel within the country. So if students or faculty are traveling to other places in the U.S. In the next few days, is there guidance about that?
Do you want to handle that?
Yeah.
That'll be in the next version of our updated FAQs, but for now, Phil, would you take over that?
Yeah, hi, this is Phil Backrack, Chief of Staff. I would say that CDC did issue guidance actually this morning with regard to that. In essence, any travel in the domestic U.S. that is to an area where there is a higher concentration of confirmed coronavirus cases should be dissuaded at all costs.
I know that there was a question that came into me related to those bordering communities within the state, and that there are several cases in different areas around them, but they happen to be outside the state of Oklahoma. So I think that's a really good example of how, one, it's very important that we're all getting information and guidance from the CDC and utilizing that, and 2, that we do use that as a reminder of how some of our areas will need to have a regional response instead of a statewide response based on that. So for those who are in districts, in counties that border other states, we need to keep that in mind. There are several questions about lists of affected areas, and all of those are on the CDC website, and they're linked in our FAQs that were sent out yesterday, and they are changing on an hourly basis, so please reference the CDC website for those affected areas. Okay, we have several questions about students who are absent or forced to self-quarantine as a result of potential exposure or desire to keep a student out of school. Questions about, will those students qualify for medical exemption, and are those students to be counted as absent?
Yeah, I think the answer to that is yes, in the first part of that they would qualify for the medical exemption. If we're talking about the chronic absenteeism piece and the assessment piece, a determination locally about absences, that's a local determination. But if we're talking about at the state level for assessments and accountability, I think the answer is yes, those individuals. If it's quarantine related, coronavirus related, I think, again, we're making broad interpretations of things right now.
Okay, and Todd Lofton is here and might just pitch to you. Can you give maybe schools just a little brief synopsis about things that they ought to be thinking about with regard to special education students?
Right, so in general, for a school-wide closure, services wouldn't be necessary to provide to students who don't have an obligation for up to 10 days, and it wouldn't be a change of placement for an IEP student. After that, you'd need to consider what comparable services, according to the IEP, you could provide to the most appropriate extent possible. Any services that you cannot provide, related services that you're unable to provide because of staffing issues or locations, immediately upon return to school, IEP teams should meet and determine the need for either extended school year services or makeup services, depending on the child's individual needs. Right now, schools should be working to develop protocols for communicating with parents about the services their children will receive. And you could also engage in developing contingency plans for particular students with, especially those with more significant needs, about what to do, how to provide them instruction in the event of a school closure, which could be online or packets going home, something like that, depending on the IEP team. I'll say that IEP timelines and reevaluation timelines, all of those, obviously during a school closure wouldn't necessarily matter. What would be important is that a district's communicating with the parent and documenting that they are, and that upon return to school, that those meetings are held as soon as possible.
Okay, thank you. Superintendent, we're getting lots of questions about school activities and the Oklahoma Youth Expo, and do we have recommendations for school activities going forward? Do you have any thoughts on that right now?
Yes. Well, so this is a great example of something where it is, as everyone knows, Youth Expo is a private partnership, I guess it's actually a 501c3 nonprofit in partnership with the Department of Agriculture. This is an example of a time where if a school feels their students should not be a part of that, they can make that decision as a school-related activity, or if families believe that that is not appropriate for their own student due to asthma or other concerns that they have, and how that impacts their family or community, that is something that needs to be respected. However, we don't have any type, the government agency to visit about that would be the Department of Ag, and because that is their partnership. We care about our kids, of course, and we understand the pressure on both sides. I've heard lots of different comments, and there doesn't seem to be any kind of consensus. So from when I saw the commissioner yesterday, she had just come from there and said we're full steam ahead, and that's the decision they made for that day, and I think that they will probably look at this day by day.
Okay. So a couple more questions regarding testing. Any update on the ACT and SAT for juniors?
Yes, so we've been in conversations with both the College Board and ACT, and since this is a national issue and our tests that we provide at the state level are considered nationally comparable, it looks like they will be able to create an emergency testing window. So we don't have the specific dates yet, but we are working with them, and they are very much so in tune with the State Department of Education.
Okay. One additional question about testing. For families who do not want their kids to be in school as a result of the virus and then therefore miss state testing, how is a school to handle that situation?
So the local school would determine whether they count the student as absent, obviously. If the student is home because of the coronavirus, then they can, the district has a coordinator typically, can request a medical emergency exemption. If there's a large-scale disruption, in this case, the State Department can look at school sites on a case-by-case basis if they fall below the 95%.
Right. I want to also, I know there's been a question that's come through about what is your recommendation for spring break travel for school groups? And I'll just tell you my recommendation would be that we don't do that. So that's it.
Okay, we're getting a lot of repeat questions, and I know that this has gone very fast. So Superintendent, is this being recorded?
Yes.
Will it be posted on our website?
Yes.
For people to be able to access? And then where can they find the FAQs and the latest information from us?
I think what we can easily do, where do we? We'll provide guidance. We'll email that back to those of you who were on the invitation, so that you have that information. But just know that this is something we're going to do regularly, and we will have new communication as well. Later today, it's being updated. Steffi can...
Yeah, Superintendent, it's the very first
If you go to the first document on the home page on what's new,
it will live update.
it will live update as we add new information. Also, speaking of other things that are new, on the document of coronavirus COVID-19 FAQs for Oklahoma Public Schools, the first hyperlink, which says in the first little bit under about the coronavirus, it says interim guidance for schools. That has been updated by the CDC, which includes a school decision tree. And that is new information, and that I just want to draw your attention to that. Steffi, what was that?
The tiered.
It's the tiered recommendations related to some of what we were talking about earlier: preparedness phase, mitigation phase, containment phase, community transmission, and how schools can think through where they are on that. You can use that to anticipate how there could be a state-level response or guidance for isolated responses, but this gives you things to be considering as you begin or modify your current plans for a response for what we know is going to come. I mean, this is not something that Oklahoma will not encounter, and we just want to use this time wisely to be prepared so that we are just executing our plans when the time comes.
Maybe one more question here. Do we have any recommendations regarding our older teacher population and if they're concerned about coming to school and possibly being exposed?
I think that's a real concern, and one that I'm not sure if we've addressed at all in the guidance.
There's a lot in the guidance about employee leave, support employees versus non-support employees. Excuse me. I think a lot of this needs to go kind of where it started in the guidance in local determinations as far as leave policies, absences, things of that nature at a local level. You all are uniquely positioned to make these determinations best in a lot of these cases.
Also, there is, it is my understanding that the President will make an announcement today related to a national declaration of emergency, which actually then triggers the federal reimbursement under the Stafford Act. And so there's a whole variety of things to consider related to that with affected individuals who must be quarantined or are under the doctor's care with a positive case of coronavirus. So that will come, and there will be other, if there are needs for our state-level response, I mean, those are other things that could trigger changes. So to answer some of this today is information that could not necessarily even apply or be needed in the future. Okay, I think that there may be others that have asked questions that we will review if we've missed something that I think if you've asked a question, I think we are able to see where that came from, so we can get that out to you individually or add them to FAQs if there's a general need for that to be answered for all. I did get some text messages, so thank you for that, and that gives us some direction for other things we need to cover in the future. Thank you very much, and we'll be in touch. Appreciate all of you. Thank you.